team, because without this event would not be possible. So my name is Dr. Nicholas, so I'm a Singaporean. And one thing that I'm really, really excited to speak about is mental health, because too many times I see practices, they just talk about neck pain or back pain. But then the thing is, a lot of it we're not told. Even in school, we're not told about that it can help mental health. And people don't even know that we could do that. And historically, we have been doing that. And then up to the 70s, which I'll be sharing with you, and this is pardon me, it's not an easy topic to talk about. It's a bit dry, but I'll try to make it exciting as well. Because history, right? As just now James said, if we do not know where we came from, we don't know where we are going next, right? And hopefully it can inspire some people to continue research in this. And I'm really grateful to my professors, Dr. Tracy Littrell, Dr. Roger Hines, and also Dr. Scott Jackson for introducing me this book in 1973 on Herman Schwartz on mental health and chiropractic. So Dr. Hines is the chief historian at Palmer Archives and Palmer Special Collections. So if you guys happen to be at Davenport, Iowa, go visit James Chester, right? He's from Davenport, Iowa, or visit the Palmer Archives. Right, so I mean, a lot of it, because people ask me, why am I going to talk about mental health? Because honestly, it's just, when I was in Palmer, I was always asking myself, why am I taking all these classes? I mean, it's great to be a doctor and all that, but then later on, luckily I was grateful to meet a group of philosophical people, and we started the philosophy club at Palmer as well. We started the club, and then we would drive to events, where I'm grateful to meet one of the events. We met Dr. Billy Chow there in the US. I met a lot of people here, and it was gave you certainty to why you do what you do. And sometimes when you see clients in the office, and you just do not know whether you can help them, but then your certainty can just help them, right? And this is you can connect with me. This is can scan. This is my WhatsApp. I like WhatsApp. And it's such a small group that I really want to connect with all of you guys. So my question is chiropractic really just neck pain, back pain? But then, you take that history, you do this test, you do that test, and then you spend 1 hour. But then is that really what it is? Or is that what Peter yesterday talked about, the bigness of a why, right? Why we do what we do. And this man, D.D. Palmer, our founder, said, right, because nobody knows chiropractic as much as this guy, right? Because he had the vision and say, I desire to know, the people, just look at the people on your left and your right. If they look the same, but they sit on the same bench, same shop, but how come one was ailing and one was not ailing? Think about that. Maybe that's linked to the subluxation. And in Davenport, Iowa, around the time of 1910 is when D.D. Palmer published his book, 1910, The Chiropractic Adjuster, right? And really at that time it was booming in Davenport, Iowa. There were a lot of types of chiropractors, and D.D. was just, he was able to help many people with people that the doctors don't want to see them. And he was able to help them. They got better. They called D.D. the miracle healer. And then a lot of people want to study chiropractic at Palmer, at Davenport. And then later on, there were a lot of people coming up, and there were a lot of schools, a lot of associations, a lot of groups that were coming. Then later on, we have this man. He was from Holland and graduated at Palmer in 1922, Dr. Gerald Martin Pontoff. So a lot of times, this man was I would think he's one of the pioneers in mental health in chiropractic. So around that time, he knew that a lot of people were suffering from mental disease. They were in their homes, they were unmanageable, they were deranged, and he said, they probably subluxated. And what if I clear them? Would they get better? And he tried, and many times he adjusted them, and it seems that they became calmer, They became more aware of themselves. And then he says, however, this is just my thing. I need a hospital to prove whether my theory is going to be the truth, right? And later on, through some partnerships with different people, we have Forest Park Sanitarium in Davenport, Iowa, that sprung up. And at that time, they were creating, they needed facilities because in state hospitals, they were dunking people in the water, they were electrocuting them, they were slapping them, they were kicking them, because they just didn't know what to do with mental patients. So if anyone chiropractic say, if anybody tells you that the adjustment is forceful, think about that. Will you rather that trust the power of the adjustment, or will you be rather, get electrocuted? Will you rather get kicked? Would you rather get slapped? And that's what they've been doing. And that's why these people was inspired to create these facilities. And another guy, I think one green book was named after him also. He was the dean of Palmer School, and many of the faculty got on staff at these colleges. From the colleges to the facilities. And, we have the second facility later, Clearview Sanitarium in Davenport, Iowa, where James was. James, have you seen that area there? Yeah. So, when you look at Clearview, many of them, the people were so close, and they try to treat the patients there like their family. When interns from the Palmer School got there, they try to become their friends because that was more powerful. And then the interns would then invite, it was like family. They would invite them to their house for dinner, and I thought that was fascinating. Because the best way to help people with mental health is to love them, right? Amen. And when you love them, they get better. Amen. And then the next thing is, of course, give them the adjustment. Then what you can train it. And then just a fun fact, anyone here practice using the drop piece, right? And do you guys know where the drop piece was first tested? Clearview. There you go.
1941.
That was, so, you can see this place there. They really are taking good care, because without them, where does these people go? You have deranged people roaming the streets. And as James was saying, if they clear them, perhaps we're a better society. Right? And you can see state institutions, they were doing all these invasive things. And so the next time, maybe you see somebody who's having, a mental hard time, right? So another thing, I'm going to say, we don't want to give our assistant there, she has our swag, ADIO, and, because later on she'll be stressed, she cannot sell out. So as the talk say mental health, to keep her mental health, okay? Go get one later in the break. Right? So later you can see BJ, a nice photo of BJ and Herbert Hender. He was also, Herbert Hender was deep interest in psychopathology and psychotherapy. And they were really exploring, researching about how chiropractic can help mental health. By the way, this talk is supposed to be 2 hours, but I've condensed a lot of material. But I will try my best, okay? And then, you know who this man is? This man is Mabel's nephew. So it's also BJ's nephew. He joined the faculty in 1940 and began working with schizophrenia clients. So today, if you see any schizophrenia clients, I hope you're just not gonna I cannot help you. You need to take physical therapy or something, right? Adjust them, love them, right? And you can see the turning point was also, a lot of things happen for a reason, but this thing in 1950, in January 7, something big happened. There was fires happening in Davenport, Iowa, right? It burned a lot of records, and 39 nurses and patients died in that. And a lot of records were burned. But then that's not over. Because of the good work they put in the early days, later on it also inspired others to open other facilities. And, he even said that this guy was a judge, by the way, in Davenport, Iowa, and then later on he came to Davenport, but then he was from South Dakota, and then later on he was so convinced that he tried to convince legislation that chiropractic really works for mental health. And, he said that we need to influence all the people, and as James said, we need to influence all the politicians that chiropractic works. And then they may make better decisions to care for our mental patients, and you might not even hear about this, but these things I'm telling you that a lot of people will not tell you, right? And interestingly, that in the 1950s, they have a joint commission on mental health and health report, and they also try to put all the practices, all the great, all the do's and the don'ts on how to manage mental health. They try to put in this document. And then later on, as I mentioned, because of the good work they put in the early days, other facilities came up, like the Buckham Chiropractic Clinic in Hospital in Iowa, the Grandview Sanitarium in California. In Illinois, there was another facility right here. In Kansas. And then, of course, the well-known in Denver, Colorado. There's a book, by the way, written by the Association for History of Chiropractic. So I really, really hope that all of you can join their page, Association of History of Chiropractic, because they are really doing all they can to preserve all the knowledge, all the events of chiropractic. And they even published, I think they republished his book, this guy. It talks a lot about the hospitals that this guy actually set up. So later on you can look at their page. Yeah, and later on you see the board was so stunned by the success of the hospital that they listed, in the American Psychiatric Hospital Association, they listed it in their annual publication. However, all good things must come to an end, right? BJ was so into this that in 1961, unfortunately, he died in Florida. It put a lot of stop to a lot of things, and we need another great leader. And his son, David Palmer, took over, but many of them were not interested in carrying on the sanitarium work, on the mental health work. And, BJ's nephew said, and if you actually listen to them, they would say that if BJ would have probably survived another 6 months, today we might have a mental hospital for chiropractic in the US. And there was a lot of lost research, in the fire, there were things, it also interrupted a lot of the studies that was done. But fortunately, Herman Schwartz had the vision to publish a book in 1973 called Mental Health and Chiropractic. This is the reprint. I think Matthew McCoy Press in the US, he republishes it. And this is the original text. So I'm grateful for Dr. Scott Jackson in the UK. He sent me this text. And, it's just amazing. Like, people documented everything in the sanitarium, whatever happened there. All the great work that they put in. And honestly, it urges us to re-examine, because honestly, you look in the world, 20% of the population suffer from mental disease. And what do? Many of them, they do not know what to do. They just jump down because nobody could help them. But with your hands, you could help them. And, this book was so powerful because there was 2 Nobel laureates helped co-author this book. imagine we have Nobel laureates in chiropractic willing to lend their credentials, willing to lend their names on the book. That's really powerful. So I always have great respect for the past. If you do not know where you are coming from, you do not know where you're going. And it's really true because, and if you are a chiropractor, everything is your business. History, the philosophy, the science, the art, everything is your business. And we respect our leaders too, right? They gave us a gift. And like what James said, we got the sacred trust, right? As BJ would tell us. And of course, more and more research have now shown that, chiropractic help conditioning, muscular tension, emotion, and a calm body leads to a calm mind. And, chiropractic can help it because when mental disease comes, it's a state of anxiety and state of deep relaxation incompatible and cannot coexist, right? And a lot of it was like, you just know that when you actually touch somebody, you affect their nervous system in a way that is unimaginable. And maybe that thought that they're depressed, their thought of suicide can now dissipate because of your adjustment. And you have the power in your hands to change it, right? So, honestly, I'm really fascinated because, chiropractic, every time people tell me, you run a crack house because you crack, right? But honestly, is that really what we're doing? Are we making all that clicks, that cracks and all that sounds, or are we changing lives? Because each time you input that force, you change the nervous system. Because many other professions out there do the clicks but what really separates us is the philosophy, right? And locate, analyze, and detect vertebral subluxation so that we can change lives out there because no other professions out there do that. So next time anyone tells you chiropractic is neck pain, back pain, tell them it's not. Chiropractic is life. And it's so much more. Our forefathers have told us that from the 1920s all the way to 1973. And, unfortunately BJ has gone. But now, honestly, it's on us to take the torch forward. And the brain, when the brain is free from subluxation, when the brain is free from interference, what could be possible? Do we need a list to say, we can help neck pain, back pain, knee pain, Do we need that? Or do we know that in the power of our hands, we really can help somebody feel better? So it's really up to us to take it forward. And we always want to be very mindful when people with mental health coming in. That's why, as Shara always says, we need to be really, detailed and try to know them, just like a 5-year-old. Think about it again. It's not neck pain, back pain. It's bigger, better, and it's about life. Thank you very much.
Awesome, Nicholas. Raise your hand if in the last few months you've had someone in practice that said to you,